Glasgow coma scale. So it's also known as the GCS score. So here the values are 13 to 15. 13 to 15 indicates basically a mild injury, and 9 to 12 it indicates a moderate injury, whereas less than equal to 8 it indicates severe injury. Now looking at the head injury clinical classification, the eyes is what we are looking at. So there are different divisions: spontaneous and to verbal command, to painful stimuli, as well as which do not open, and next is not testable. So in this case, in case of spontaneous it is score of 4, in case of verbal command it is 3, in case of painful stimulus it is 2, and in case it doesn't open it is 1, and non-testable is nothing but NT. So 4 is spontaneous, 3 is verbal command, 2 is to painful stimuli, and 1 is do not open, and NT is nothing but it is not testifiable. Next, looking at the verbal response. In verbal response, there is 5, 4, 3, 2, 1. So first one is normal, and it is oriented to the conversation. Next, it is also in case of confused. Next, inappropriate words. Then there is only sounds, and there is no sounds, and next is non-testifiable, NT. So in case of normal oriented conversation, the score is 5. In case the patient is confused, it is 4. In case it is inappropriate words, it is 3. And in case if it is only sound, then it is 2. And in case there is no sounds, it is 1. And NT is nothing but non-testable. Next we are looking at motor. In case of motor response, there is something known as obeys command. In case the patient is obeying command, and next if it is localized to pain. Localized to pain. Next is withdrawal. Withdrawal, or in case of flexion. Next is abnormal flexion, or also known as decorticate posturing. Next, what is involved is the extension as well as the decerebrate posturing, and no motor response, and non-testifiable. So in case of motor, if the patient obeys the command, it is 0.6, and in case it is localized to pain, it is 0.4. If it withdraws and there is flexion, it is 0.4, and there is abnormal flexion, or it is known as decorticate posturing. In abnormal flexion or decorticate posturing, it is nothing but 0.3, and in case of extension and decerebrate posturing, it is 2, and in case there is no motor response, it is 0.1, and in case NT is nothing but non-testifiable. So other points to note in GCS is that the maximum value is 15 and the minimum value is 3. And why it is done? It is basically the best predictor of neurological outcome, and so the best predictor of the neurological outcome.